Now we will review PPE removal, or doffing. Where PPE is removed depends on whether the patient room has an anteroom. If there is an anteroom, all PPE, including the N95 respirator, can be removed in the anteroom. Airflow from the anteroom is being pulled into the patient room, so respiratory protection is not required in the anteroom. If there is no anteroom, gown, gloves, and face shield or goggles are removed and discarded near the door just before exiting the room. Respiratory protection should remain in place until you are outside the patient's negative pressure isolation room. Gown and gloves are the first item of PPE to be removed. At MGH, the one-step method of removing disposable gown and gloves together is used. This is accomplished by grabbing the gown materials at both sides of your waist and then pulling forward, which will cause the ties to break. Continue pulling forward, which will cause the back of the gown to tear away. Roll the gown into itself, peeling off your gloves at the same time, only touching the inside of the gloves and the gown with your bare hands. Hold the gown away from your body and discard in a waste container. Next, carefully remove the face shield or goggles, being careful not to touch your face. For the face shield, grasp the strap at the back of your head, pull the strap over your head in a forward motion, and move the shield away from your face. Do not touch the front of the face shield or goggles and dispose into a waste receptacle. The last item of PPE to be removed is your N95 respirator. This is done outside the airborne infection isolation room. Remember that the front of the respirator is contaminated, so never touch the front. To remove your respirator, slowly lift the bottom strap from around your neck and up over your head. Next, lift the top strap off your head and move the respirator in a forward motion away from your face. Discard the respirator in a waste container. The final important step is to perform hand hygiene with alcohol-based hand sanitizer after all PPE is removed and before you touch your face or clothing or any surfaces outside the patient room.